response to room 315. Rapid response to room 315. Rapid response to room 315.
This is Hudson Regional Hospital, situated in the middle of one of the hardest hit areas during the peak of the pandemic.
12 move to room 315. 12 move to room 315. 12 move to room 315. Are we recording?
Is he?
When was he last seen?
Yeah, but he's fine. He was fine.
Okay.
He was fine this morning.
That's okay.
He's cold.
Let's call the family. I don't know.
The patients are pretty calm, but when it goes bad, it goes back quick. That's the problem. Definitely didn't think this was gonna happen today. And it's nice.
The hospital morgue is so overwhelmed, they had to bring in a freezer truck to store all of the bodies.
This is the trailer where they're currently placing the deceased patients.
Chris Morrell says in the last 8 years of working here, he's never seen anything like this.
At most we would see 2 here. 3 was like, you know, something rare. Now we're getting 4, 5, 6, 10. Everybody's scared. We're all here trying to do everything that we can. That's just what it comes down to.
The thing is, like, we're not like resting a second in the day. Like, we're still going around, seeing this, seeing that. Called for a code blue. We have to talk to the family. It's just like a continuous. It's like I'm short of breath. It's a continuous workload.
Dr. Nawar al-Obaidi has been surrounded by death before. He's originally from Baghdad, where he saved and lost countless patients during the Iraq War. Now working in the epicenter of the pandemic, he says battling COVID-19 reminds him of wartime.
It's worse than the last time we went in war because this virus is killing people and we don't have anything to prevent it so far. The virus is running like in a full speed and it's killing people really fast.
Does it take a toll on you just seeing so many people die?
What I tell you, in one day, I made death certificates more than I did in the last 8 months. In one day. It's really devastating.
How are you doing right now?
Well, it's like a day-to-day scenario. Wake up in the morning and I go to work and I see who's coming, who's not coming. Actually, it's a very interesting scenario because we lost a lot of people to sickness. Like, we are in shock, basically. We're in shock.
This is one of our sections. This is fast track.
Paula Rios is a 35-year-old nurse with asthma. This is her first shift back since recovering from COVID-19.
I had every symptom possible. I had to call off the shortness of breath. I got to a point where I felt like I couldn't breathe, like I was drowning. I kind of feel I know what the patients are going through. So it kind of gives me more of a sense of what I should be doing and helping them to feel better and be able to breathe better. I got sick and everyone else in my house got sick. Fortunately, my son, I was able to get him out the house, but unfortunately I haven't been able to see him for about a month, so. I'm gonna take my stuff off. Hola, abuela. My grandmother got sick. She's 90 years old. She's actually admitted in the hospital right now. I'm glad that at least I'm able to see her because unfortunately, many families who have patients who are sick can't visit. Tiene que descansar. Having this disease and not being able to breathe is something that you can't describe. And then thinking that all these deaths are happening is very scary. You get a lot of anxiety. You don't know what's gonna happen.
Mommy can stay today?
Well, you can stay today, definitely.
Dr. al-Obaidi says up to 70% of his colleagues either tested positive or were out with symptoms. He's one of the few frontlines workers here that hasn't gotten sick until this week. When you first started getting the symptoms, like what happened? What did it feel like this past weekend?
I didn't feel this in my life, like this kind of shortness of breath. So I called my colleagues, like, please cover me for the rest of the shift. I'm gonna rest today and tomorrow and see what happens. But then at work, they were worried, and it's like, okay, let's do the test since we have it here.
حبيبي اعطيني خلقة قليلة. نوار مستشفى هسه جيت. You just came from the hospital. يعني seriously. You need to eat at least.
Dr. al-Obaidi took the test but kept working since his already infected patients needed him. Meanwhile, his family is racked with fear that he too could end up alongside his patients.
She said, I feel metal or metal taste.
His wife Hala was also a medical doctor in Iraq. When you think about Nawar going to work every day, and you know he's, of course, getting very close to these critically ill COVID-19 patients, what concerns you?
What concerns me that sometimes he is not careful enough. That he might just like jump into the room right away without putting the mask, without putting the needed PPE before he gets into the room, because he will put this patient first without even thinking.
Do you get nervous when your dad goes into work, like knowing that he's going to be in such close contact with patients?
Yeah, it's a hospital literally filled with everyone who potentially has corona, and it's literally all over the air.
Your wife is concerned about you. Your sons are concerned about you. Is it hard to know that?
We have to go, we have to work, we have to save people and come back home and hope like the next day I'm not sick so I can go again.
1/3 of all coronavirus deaths are nursing home residents or workers. These doctors have to make tough decisions around do not attempt resuscitation policies, or DNAR.
Either 100%.
With some elderly patients, the question becomes, if they flatline, do we bring them back?
The nursing home facility contacted me this morning. They have potential patients that need to be transferred over. We just need to make sure that we have enough machines for those patients.
So I went around yesterday prognostically looking into who would probably do well and who would most likely not do well at all. And I personally made at least 7 or 8 patients DNAR. However, I went down to the ER and there were a patient that was already intubated, is 91 years old. And there was a patient that I advised the day before that the patient should not be intubated at 91 years old with COVID. What is the status in the ER, especially now with these patients that are coming from the nursing home? Are we going to make them DNAR?
So for the ER, I'm okay with them acting in what they think is the best interest of the patient at that moment. If it's a nursing home patient, a lot of those patients come in with their own set of orders, whether it's DNR, DNI, whatever the situation may be.
When a patient is put on a ventilator, they're carefully monitored. With only an estimated 20% chance of recovery, stories of survival for these patients are rare.
How you feeling? You're welcome. It's great seeing you talking. I'm glad you're here too. You made my weekend.
Pedro Gonzalez is only 37 years old. He survived after 22 days on a ventilator. Doctors here say that's unheard of.
He was having a very difficult time breathing. Most of the time when somebody's awake and alert, you don't need to intubate them. So I asked him if he wanted the breathing tube, and he said, yes, put it in. And then he said to me, but don't let me die. So.
All right, so let's start with the Connie occupation one. What order they call it? 7 point.
While on rounds in the ICU, Dr. al-Obaidi's test results came back.
Negative.
And what's the best settings with that?
I don't know how. I have all the symptoms. So.
Pressure control 180.
Okay. Good.
Against all odds, Pedro returned home to his wife and kids and is expected to make a full recovery. Living through 4 wars, coming to the US, then a global pandemic hits and you're serving in the epicenter of it. I mean, how do you survive? Like, how do you keep going?
I just don't think about it. I think day to day, I think I'm lucky because I made it so far. And let's hope the luck continues. We have to continue until you can't.